We were initially interested in exploring the mental health differences in the marginalized group of deaf individuals, looking to see if there were any trends in the rate and type of mental health diagnosis, as well as the treatment they received. Before looking at the differences in mental health for deaf individuals, it is important to understand a little about deaf culture. There is big D deaf for those who are culturally deaf, while little d deaf represents the audiological condition of hearing loss. Some of these social interactions and behaviors found in deaf culture may be viewed as different. For culturally deaf people, maintaining eye contact is important, and avoidance of eye contact may be interpreted as rude. Touching another person on the arm or tapping an item or the floor to get their attention is common and acceptable. Additionally, when communicating, deaf individuals tend to stand further apart than hearing people in a verbal conversation and speak in a direct manner, which may be considered blunt or offensive. Furthermore, deaf individuals act out roles and emotions with their whole body when telling stories in ASL. The rates for deaf children to have a mental health diagnosis is significantly higher than hearing children, with deaf children being diagnosed with conduct disorder, ADHD, bipolar, and pervasive developmental disorders at higher rates. Looking within an educational setting, teachers rated substantially higher rates of total problems for deaf students, with the highest endorsed symptoms within the indices of social and thought problems. When comparing treatment, it was found across studies that deaf people were in mental health treatment for longer periods of time for similar diagnoses. Deaf children were in treatment for 32 months longer than hearing children, as well as deaf adolescents with an increase in treatment of 20 months. Problems that lead to inaccurate diagnoses include not accounting for the impact of language development, access to communication and education, and deaf culture. Additionally, a lot of mental health assessments are not standardized for deaf with ASL, and there are errors in the translation which can impact the results. The delay in language acquisition is related to poor social relationships and emotional development. This common deaf experience with the lack of full communication has been shown to be related to social and behavioral problems and mental health concerns. The lack of communication in the home or at school prevents deaf children from being able to discuss abstract concepts and emotions, limiting them to concrete topics. Furthermore, deaf children are often diagnosed with an intellectual disability on assessment measures that are not culturally appropriate nor have proper translations. Lastly, culturally competent treatment providers are often not available for deaf individuals seeking mental health services, which is likely the cause for longer duration of treatment in the deaf population.